All right, so we are going to go ahead and get started. You're welcome to keep putting in the chat where you're joining us from. It's fun to see that we do literally have people all over the world right now. So again, good morning, afternoon, evening, wherever you are. Thank you for joining us. I'm Bronwyn Watts. I work in the Office of International Programs, and today we are doing the CSU Health Network Zoom webinar. And so I'm going to turn this over to Urusha and let her take this over. But I will just note that if you have a question for the Health Network, please put that in the Q&A. There'll be some other opportunities where they might have some quizzes. You can answer those in the chat, but please put all your questions in the Q&A. And with that, I will turn this over to Urusha.
Thank you. Hi, everyone. My name is Urusha, and my pronouns are she, her, and hers. I work as communications coordinator for CSU Health Network. And yes, I'm so glad to be here. And in today's presentation, I will be talking about the general services that are provided for you at CSU Health Network, also talk about new student requirements and recommendations, also discuss the student health insurance plan for international students. So yes, it's a lot of helpful information, and the information that I'm going to share today, all the information is available on our website, health.colostate.edu. And like Bronwyn said, please, as you have questions, as I follow along with the presentation, as I go through to the presentation, please put your questions in the Q&A function. And after a few minutes, we will also have representatives from immunizations department and insurance department to answer your specific questions about immunization, vaccinations, and your insurance plans and things like that. And after my presentation is over, I will also be able to answer general questions about the services, and we'll go through all your questions after my presentation is done. So hold your questions for me towards the end, but if you have questions about immunizations or insurance, you can put them in the Q&A function, and our reps will be able to give you replies to your questions. And yep, without any further ado, I want to begin. So I am sharing my screen right now. Can you see my screen? Okay, all right. All right. Great. Yep, and thank you for joining from different parts of the world. And it's so exciting to see students from everyone. So yep, welcome to CSU and CSU Health Network. CSU Health Network is every student's home for on-campus healthcare and well-being. And at CSU Health Network, all enrolled students have full access to a wide range of services, regardless of their insurance plan. So regardless of the insurance plan that you have, if you are enrolled in student health insurance plan, which we highly encourage you to do so, especially for international students, or even if you have private insurance coverage, all enrolled students have full access to a wide range of services. And we offer integrated care for the whole student, which means that our providers work very closely with the students to make sure that not just their physical health, but also their mental health care needs are met. And for that, we have 200 plus providers and staff members who are experienced working with, they have a lot of experience working with college population, and they're very passionate about college health. And all these providers have gone through years of rigorous training and certification. So all of them are accredited by AAAHC and then the American Psychological Association. So all these are qualified experts and providers who will be able to help you in your time at CSU. So our services are divided into three categories: medical services, mental health services, and health education and prevention services. So For medical services, we have general medical services and specialty medical services. So under general medical services, we have primary care. So you can also think of it as your regular doctor's office. So if you're not feeling sick, you can always come in and see the doctor. We also have pharmacy on the first floor. So if you are taking medications, you can pick up medications and prescriptions from the pharmacy, or if you're already taking prescriptions, you can transfer your prescriptions and pick it up at our facility. We also have immunizations on the second floor. So in the fall, you can get your flu shot, and also, other vaccinations that are required for students. We also have lab, radiology, and behavioral health all in the same building. And I think what sets us apart are our specialty medical services. So we have dental, we have optometry. So you can schedule your annual eye exam, get your teeth cleaned. And we also have LGBTQ plus inclusive care. We have physical therapy. So anytime you get injured during a sports event or anything, if you need to see a physical therapist, we also have physical therapy office at CSU Health Network. And we also offer sexual and reproductive care, sports medicine, travel medicine. So yes, all these services are available for all students. So mental health services. A part of the student fee that you pay provides for a wide range of mental health support resources at CSU, and those include brief individual counseling, therapy groups, skill building workshops, psychiatric services, post-hospitalization support, crisis intervention. So you might be thinking what skill building workshops are, and these are workshops that are geared toward a specific problem that you are going through. So for example, if you are looking for workshops to manage your stress, so we have mindfully managing stress workshop, and there are also workshops for anger management. We also have exploring substance misuse if you're trying to solve that problem. We also have dealing with trauma, if you're going through trauma, also relationship trauma. Well, we also have self-exploration. And I think the other service that really stands out mostly for international students is multicultural counseling. So we also offer identity-based group counseling, where you'll be able to connect with people from like the same culture. And then, this is a very popular skill building workshop especially for international students. And we also have a lot of wellness workshops. And all the information is available on our website at health.colostate.edu/mental health resources. So how can you access counseling services? So what do you need to do, right? So first step is you'll first come and see us at CSU Health Network. And then you'll meet with an on-call counselor, and you'll have to go through a brief screening process. And what the screening process looks like is you'll meet with an on-call counselor, and you'll co-create a wellness plan with the on-call counselor. So, and depending on that, the on-call counselor might recommend you to individual therapy, or they might recommend you to a skill building workshop. They might refer you to group therapy workshops. So, and these are based on your unique circumstances. So it depends on what you want, what your individual needs are, preferences are, and how you feel comfortable. So after that brief interaction with the on-call counselor, they will refer you to all these other resources. And after they have given you that referral, you'll just commit to your personalized wellness plan, and hopefully you'll attend all those appointments, groups, and workshops, right? And you'll also follow up with any recommended campus or community resources, and you will practice and maintain self-help skills and tasks discussed during those sessions. So health education and prevention services. So this is our outreach arm. So we, through this office, we offer a lot of, we offer education around substance misuse prevention, sexual health, and stress reduction and things like that. I get asked this question a lot by students that they want to work at CSU Health Network. So for students who have the required permissions to work at CSU. We also offer job employment opportunities through the Health Education Prevention Services, and all the jobs are posted on Handshake. So you can apply to jobs through Handshake and work for us for health education and prevention services. And yes, it's a cool opportunity. There are also a lot of volunteer opportunities for students. So all the information is on our website. And so this is the building that I was talking about, and don't be confused. You don't have to go to different buildings or different places to utilize like different resources or services. All the services and all the medical services, counseling services, everything is all in the same building. This building is on the opposite end of the campus. But there are several easy ways to get there. We have free patient and client parking. We also have a max bus stop right outside our building. And this building is about 10-minute walk from Lowry Student Center and from the Clark building and from major other buildings around campus. So it's pretty accessible. So I'm going to answer like the basic what, why, where, and how, why should you come to CSU Health Network? Excuse me. So you should come to CSU Health Network to help you with your mental health care needs and physical health, so you can succeed in your academic performance and also in your personal life, because we want you to succeed when you're at CSU, right? And you should come here because if you want to, if you want to prioritize your health, and if you want to adjust to a new environment, and if you're having problems adjusting, and if you want to talk to a counselor and get feedback, and there's a misconception among many people all over the world that, you only go to a counselor when things are really bad or when you're like severely depressed or anxious, but it's not like that. Even when you are, even when you need like a third person perspective, if you need like encouragement, if you're just going through a hard time in your life, you're just going through a difficult phase, you can always come and talk to a counselor. And yes, to solve problems that you will encounter on a daily basis, and we are here for you. So when can you come? So our facility, CSU Health Network, is open 8 a.m. to 5 p.m. Monday through Friday, with updated hours during university holidays and closures. But if we are closed, all that information will be up on our homepage. So all that information will be available for you. And what if you fall sick, or what if something happens after 5 p.m. or in the weekends, right? You must be wondering, what do I do? So we also have after hours nurse helpline. So you can call that number. And if you want to take a screenshot of this page, you can do so now. So after hours, you can call the nurse helpline, and the on-call nurse will be able to guide you to how to better take care of your situation. And she might also, if it's a very urgent situation that you're going through, and if you need immediate help, she can also give you contact information of some local urgent care facilities that are in Fort Collins or Colorado. And we also have 24/7 mental health crisis intervention line. That means there is an on-call counselor available 24/7 hours for you. So if you are having, if you just want to talk to a counselor, if you're having difficulty just regulating your emotions, if you feel overwhelmed, or if you just want to know how to, better handle your situation and your emotional and mental health, you can always talk to a counselor. Don't wait until like things get really bad, like I said, and please utilize this resource. The number is available over there, and our 24/7 mental health counselors are available 24/7 to help you. And like I said, don't wait and come early when problems are just starting. So how can you do that? Like, how can you access the medical services? I talked about counseling services for a little bit, but how can you access the medical services? You can call our general number 970-491-7121 to make an appointment. Or you can just walk into our offices. We also take walk-in appointments. or if you do not like talking to someone in the phone, or if you obviously students are best served by appointments, and so you can also schedule an appointment online using CSU Student Health Portal. And I will go in detail about CSU Student Health Portal and how you can access those and where is it on our website in a little bit. But all these three options are available for you, and you can choose whichever you like. So like I mentioned, we also offer after hours care, and I've talked about this already. We have the 24/7 nurse helpline and mental health crisis intervention line. And there are also information about local urgent care facilities on our website. So yeah, check it out. And then in the event of a life-threatening emergency, you'll always call 911 at first, and then other places. I'm sure the different countries have different rules and like how the health system works, but especially in America, if you are going through a life-threatening emergency, first you'll have to call 911 on your phone. And then just some extra information about the Poudre Valley Hospital Emergency Room, and also about Fort Collins Medical Center. So all these information I pulled up from our website, and it's also available. So if you want to take a screenshot of that for future use, you can do that now. Right. So how will you pay? That's the question that most of you might have. And your health insurance will pay for medical services. So if you are enrolled in CSU Student Health Insurance Plan, medical services are paid at 100%. So you don't have to pay anything as long as you have the CSU Student Health Insurance at CSU Health Network. And what you owe depends on your health insurance plan benefits. And your counseling fee, like I said, a part of the student fee that you pay provides access to a wide range of mental health support resources at no additional cost. And since your student fee pays already for the mental health support resources, we do not charge you extra for the counseling services that you receive. And the counseling services include all those things that I mentioned before: the workshops, the therapy groups, brief individual counseling. Right, so I want to do a little quiz because I know, here it's like early in the morning, and I just want to recap some of the things that I went over. So the first question, and you can put your answers in the chat, and yep, I will go through the questions. So the first question is, what services are provided at CSU Health Network? Option A, medical services. Option B, counseling services. Option C, health education and prevention services. Option D, all of the above. And option E, what? I just woke up. I hope it's not E, but I hope you're all awake now and you're like, paying attention. Yep, I see all the answers.
Oh, good. You're seeing those. Great.
I'm seeing all the answers now. Great. Yep. Most of you are absolutely correct. And the answer is D, all of the above. CSU Health Network is every student's on-campus home for medical, mental health needs, and also for health education and prevention. So we offer all of the above. So question number 2, do you have to be really upset to see a counselor? The option is A, yes. Option B, no. And option C, they said no, but I think you do. So what do you think the answer is? Okay, I see a lot of B's in the chat. Yeah. And that's right. You don't have to be really upset to see a counselor. Our counselors are here to help you with your problems, big or small. So let's move on to question number 3. So what are reasons to come to the medical services? A, bad sore throat, B, headaches, C, sickness, D, questions about women's health. All right. Yep, I see a lot of C's. Yep. All of them. Yep. And yep, there's another option to all of the above. What do you think? All right. Yep, I see a lot of E's. And the answer is obviously all of the above. You just have to see us on the 2nd floor, the medical services, and then we'll take care of all of it. So question number 4, should you go to the hospital if you have a life-threatening illness? Option A, yes. Option B, no. Okay, I see a lot of A's. Yep, and the answer is yes. If you have a life-threatening illness or an emergency, you should go to the hospital or call 911, whichever is sooner. And sometimes it will take you a few minutes to reach the hospital, and if it's a life-threatening emergency, you should always, first of all, call 911. Right. Question number 5. Who will we tell about your visit? A, parents, B, teachers, C, friends. So who do you think will we tell about your visit? If you come and visit the CSU Health Network, will we tell your parents, teachers, or friends? And D, option D is none of the above. Yeah, the answer is none of the above. The CSU Health Network is completely confidential, and we don't tell anyone about your visit unless you want us to. So unless you specify in a form that you are okay with sharing your personal health records or like information with your parents, we don't even share information even to your parents. And this information is completely confidential. All right, thank you all for participating. Let's move on to the second part of the presentation, where I will talk about new student checklist. So as first-year students, and also you are required to submit immunization records, and those include the ones that are mandatory are the measles, mumps, and rubella vaccine, and these are required for all students. And if you are an incoming student living on campus in student housing, then you can then you're also required to submit the meningococcal vaccine taken in the last 5 years. And you will submit all the official immunization records through the CSU Student Health Portal. And the deadline to submit that is Monday, August 21st, 2023. Please keep in mind, if you do not submit your health records by the first day of class, there will be a hold on your student account, and you won't be able to register for spring courses. So make sure that you submit your immunization records before the deadline. And when you submit your immunization records, it usually takes our staff 1 to 2 weeks to process that information. So you won't see the change reflected on the portal right away. And if you don't see it, no need to worry. It will just wait until like 1 or 2 weeks and then check back again, and it will show you. And we do not accept any printed forms. So you will have to submit all the records online through the CSU Student Health Portal. So even if you have a printed form or like a printed vaccination record, you'll have to take a photo of that on your phone and upload that through the CSU Student Health Portal. And you're also required to complete health forms, and especially the tuberculosis assessment and the health history forms. And if you are interested in accessing your care at CSU Health Network, then health history form will give our providers a good background about your medical condition, about your health history, and will give them a better understanding of how to best serve you. And the deadline to submit that is also Monday, August 21st, 2023. So this is the homepage of our website. And as I was saying, so this is the student health portal. As you can see, this is the icon for student health portal, and there is another also on the green bar at the top. So when you click on the health portal, it will take you to this page, and you'll just log in using your e-name and password. So as you can see, there are a couple of options right in the home page. So you'll just click on those, and then it will take you to this page where you'll enter your e-name and password, just like logging into your RamWeb. And then this is the page that you will see when you log in. So as you can see here, you can submit all your forms by clicking on My Forms, and then you can upload your documents. And then if you have pending forms, or if you have not submitted any forms, those will come here as a notification. And if you click on those, it will tell you exactly what you need to submit and what is left and what's already been submitted. And then you can upload all the documents and other things by clicking on the document upload option. So yeah, that is a brief overview of Student Health Portal, and we encourage you to submit all your records through the CSU Student Health Portal. So I want to play a short video for you, which will give you an overview of the US healthcare system. So let's begin.
The U.S. healthcare system offers some of the best medical care in the world, but it is complex, difficult to navigate, and often very expensive. The U.S. system will also likely be very different from the healthcare system you are used to back home. In this section of the video, we offer a few simple tips. First, like most Americans, you will need a private insurance plan, either through your school or one that you purchase directly. There is no universal access or national health care like many countries offer. When you seek any medical care, the provider you choose, hospital, doctor, or clinic, will look to you and to your insurance carrier to get paid for their services. There will be no payment from the government, and healthcare can be very expensive in the U.S. Here are a few recent real-life examples. Appendicitis, $60,493. Fractured humerus, $47,445. Fractured clavicle, $18,393. Car crash or serious illness, $150,000 plus. We hope by now it's clear why you need insurance. However, even with insurance, you should still be prepared to pay some portion of the cost of your medical care. Cost sharing is an important element of the U.S. system. So medical care is never entirely free, and each time you access the system, you should expect some cost. While your insurance plan will typically cover the majority of expenses, there will be copays, deductibles, coinsurance, excluded charges, or some combination of these items that will ensure that you pay something. Carefully review your insurance documentation so you understand how these payments work for your plan. When you get sick or injured, where do you seek care? Here's where it can get complicated. The medical system in the USA is made up of a mixture of many different types of providers. Large and small hospitals, emergency rooms, private doctor's offices, urgent care centers, walk-in clinics, specialists' offices, surgery centers, pharmacies, and our favorite, the on-campus clinic. As daunting as it may look, if you keep a few simple points in mind, seeking medical care does not need to be overly complicated. The main thing to do is, if at all possible, stay out of the emergency room. Emergency rooms in the US are expensive and are designed for life-threatening or very severe illnesses and injuries. If you have the flu or a sprain or minor cut, you can go to an urgent care center, walk-in clinic, on-campus clinic, or doctor's office for a fraction of the cost of the emergency room. The best place to start, if at all possible, is your on-campus health center or clinic. These clinics are typically available at reduced cost or even free, are close and convenient, and even if you end up having to go somewhere else later, will save you money under most insurance plans.
So that was a brief overview. So to summarize what the video was saying was like, as much as possible, if you want to reduce your costs, and if you are planning on, since you'll be enrolled in CSU Student Health Insurance Plan, the best solution for you is to utilize CSU Health Network and our services, because if you utilize CSU Health Network, then medical care is covered at 100%, and you won't have any copays or deductibles or anything. And if it's not possible to CSU Health Network, then we highly encourage you to visit in-network providers. So in-network means that the health insurance carrier has a financial agreement or contract with a healthcare provider, such as a doctor, facility, or the CSU Health Network. So when you use in-network providers, or the providers that are in network with CSU Health Network, you will pay a very smaller deductible, which is just $500 for international students, and the fees are a lot less. So as much as possible, try to come to CSU Health Network for all your physical health and mental health care needs. And in order to save the cost, if that's not possible, then we highly encourage you to seek out in-network providers in the area. So I want to talk briefly about fulfilling the health insurance requirement. So all students in Colorado are required to have health insurance coverage, and you can meet this requirement by enrolling in the CSU Student Health Insurance Plan, or you can opt out to the waiver process if you can show proof of acceptable private insurance coverage. And you will be billed for the cost of the plan after registering for classes, and health insurance is required for all students. So what if you have other insurance coverage, and if you are planning to stick to your private health insurance coverage, then you'll have to submit a waiver portal, and all that information is on our website. And the deadline to do that is Wednesday, September 6, 2023, which is 2 weeks after the classes start. And the accepted waivers for health insurance coverage are most employer group health plans, approved sponsored plans, and individual plans that meet the healthcare reform law. However, the waivers that are not accepted are the short-term plans, such as the international student plans. I know there are a lot of them, like short-term plans that you can just enroll for a few months, and that you can, enroll online. We do not accept those. We also do not accept foreign plans, and we also do not accept individual plans that do not meet that law. So that's why most students stick with the CSU Student Health Insurance Plan, and it also will save them a lot of money. So for CSU Student Health Insurance Plan, the plan pays all costs for medical services within CSU Health Network, like I mentioned. And if you visit an in-network hospital or medical clinic, then 80% of the medical costs are also covered by CSU Student Health Insurance Plan. And if you visit the in-network hospital or medical clinic, you will just pay a $500 deductible. And we also have a SHIP dental plan that you can enroll in and at CSU Health Network. And there are also other Anthem dental community providers that are in network with our dental plan. So that's also a cool option. The health insurance plan also pays $150 flex dollars to use towards like non-covered services. And this plan, however, does not pay for vision care, elective services, non-medically necessary services, or over-the-counter medications. So if you take any medications over the counter at our pharmacy, you'll have to pay for those out of pocket. And as first year students, you're also required to complete online modules. And out of those, there are 2 modules that are mandatory for all students. The first one is alcohol edu, and this is required for all incoming students under the age of 23. So this module educates students about how to make better drinking decisions and how to take care of peers during parties and how to make responsible decisions when it comes to drinking. The other module that is mandatory for all students is sexual assault prevention. It educates students about different issues such as sexual assault, interpersonal violence, stalking, and things like that. We also have some optional modules. Canvas Financial Wellness is a module that helps you make better informed decisions when it comes to spending money or budgeting and taking care of your finances. And all these modules will be emailed to you to your colostate.edu email address, and it will alert students that the program is open and the module is open. And these are typically available 35 days prior to the first day of class. So make sure you complete these online modules. And if you do not complete these online modules by the first day of class, there will again be a hold on your student account and you won't be able to register for spring courses. So make sure you complete the online modules by Monday, August 21st, 2023. So we also have online 24/7 tools that are available for you at any time. So you can register for these and you can access these online 24/7 tools at any time from any place as long as you have an internet connection. So what you do, one example of the online 24/7 tool is U at CSU. U at CSU is an online student success portal, and it connects students to personalized on-campus and off-campus and online resources. And you can access U at CSU through your RAM web account. And I can give you examples. So let's say if you just go into U at CSU and type in stress, then the portal might recommend you to different workshops that are geared toward navigating that problem. And it might recommend you the Mindfully Managing Stress workshop. And if you're also looking to find a community or a group that share the similar identity with you, and if you're looking for different groups or student organizations on campus, this is also the right resource for you. You can go to U at CSU and find those communities. So as you can see, depending on what your goals are, depending on what your preferences are, and the problems that you are having, or the goals that you set for yourself, it will just recommend you to the right place. So that brings me to the end of the presentation. And I also want to talk briefly about self-care. I know that, moving to a whole new country and then starting college life in a different culture with people from different backgrounds and ideologies at first can be very overwhelming. And there might be times where you might go through periods of cultural shock, because obviously everything is different, and then the academic requirements and everything might feel overwhelming. But I want you to remember that all these are temporary phases, and you will survive those phases, and then you will slowly go through phases where you will slowly find what you're looking for, and also you'll slowly figure out a way to manage your work-life schedule, your personal relationships, and things like that. And in the meantime, please think about self-care. I know self-care looks different for different people. For some, it might be just reading books. For some, it might be going out in the nature. For some, it might be attending a counseling or a therapy session, right? So think about how you can take care of yourself and what makes you feel better, and think about what activities you can do when you're not studying or doing something serious. How can you how can you pass your time in a way that makes you happy? Because CSU has several, like a lot of opportunities for students. There are so many like student organizations that you can be a part of. There are sport clubs that, depending if you have preference for sports. We also, when you want to seek resources for counseling, we also have different types of counseling for different students. And there are so many other activities that you can become a part of, that you can do in the weekends, so many organizations that you can be a part of. So think about, what your interest is, what you want to do while you're here. And I'm sure, after a few months, and then you'll be, you'll do great. So I just want you to know that just be patient with yourself. I know sometimes it might take a while to find genuine connections and, to have that relationship with your professor and all that. But, the fact that you had the courage to leave your country and just, get an education at US College itself is like, kudos to you. It's a great achievement in itself. And, that's already the first step you've taken. So you should be really proud of yourself. And I assure you that the college experience in the US is going to be a very fulfilling one. And if you have any questions about Health Network, you can call us in our number, 970-491-7121. Our Health Network website is also very comprehensive and very informative. So all the information that you need is also available. And yes, also follow us on our social media at CSU Health Network. Our communications team always puts out very informative and also fun content for students. And all these are information that, are very helpful for students for their physical health as well as for their mental health. So I know a lot of you must be very active on Instagram. So follow us on CSU Health Network. And you can also ask us questions in the comments or send us messages through social media. And we will direct your questions to the right department and have your questions answered there as well. But yes, thank you for your time. And I'm going to stop sharing my screen and I'll go over some general questions. So I'm just going through the questions. Let's see. I won't be able to answer like specific questions about the students are asking. Those will be answered by our reps, and hopefully some of the answers have been already answered. And at the beginning of this presentation, I also added some links in the chat that might be helpful for you. And I think I will add those again. So I'm just going through the questions.
Rusha, there was a question that came through about what if some vaccinations were available at CSU, and I don't remember which vaccine they were specifically looking for. If they're looking for a measles, mumps, and rubella, we do have that available here at the CSU Health Network, and you would just need to call and schedule an appointment with our scheduling line. And then it is covered by the student health insurance. So technically it's not free, but it is covered. So you shouldn't have any copays.
Mm-hmm. Yeah. And then I see a question. It says, how can we get vision care if we need it? You just need to, like I said, schedule an appointment online or like call us in that number. And we have the optometry clinic. So you'll just need to call the appointment. So there's another question, where can I check the situation of health insurance fee and the automatic coverage for it for grad students? So we have a separate page for grad students that I can, I'll copy and paste the link of that page over here so you can get more information. And this is mostly for graduate students. So all the information that you will need if you're a graduate student. So the information about health insurance plan for graduate students I've populated in the chat. So you can just click on those.
Arusha, there's a question in there about how someone can access their insurance card. If you are having a trouble setting up the Sydney app, which we realize is a problem with some international accounts, we would have you go to anthem.com and log in there and register and make an account, and then you should be able to access the Sydney app. If you still can't access it, then we do have a Anthem customer service number. I don't know if you can put that in the chat for them that they can call to get their card. That would be 1-844-412-0752. And they would need to know their group number, which is going to be L08198. And they can call our office, which is the 970-491-2457, option 1. And we can also help them over the phone get in contact with Anthem.
Thank you, Karen. I just populated that information in the chat. So if you have questions about your digital card, about Anthem, you can call that number over there. So there was another question, when does the coverage of insurance will start? So your access to our services begins a week before the classes start. Karen, would you be able to answer that question, the general question?
Sure. Your insurance is actually effective August 1st. That's when the plan starts. However, if you access services before the new fee schedule starts, which in this case would be Flex Week. So even though you have insurance August 1st, you probably don't want to access services before August 14th unless it's urgent or emergent, because you will still pay summer access fees. So if you can wait till the 14th to come into the clinic, that is your best deal. Like I said, insurance actually technically starts your plan on August 1st.
Thank you. I see another question. Says, I'm 26-year-old and I don't have to attend the alcohol EDU course anymore. So alcohol EDU course is mandatory for all students. So for all incoming students, so regardless of their age. And there was a question about where are these courses found? So all these modules will, the link to the modules will be emailed to you. So please check your colostate.edu email address, or if you have given another email address, please check your email address. Please check your emails, and then you'll get a link to all those modules.
Arusha, there's another question in here that comes up a lot with international students. And that question is, if I'm an international student and I never use my health insurance plan while I'm here, will I be reimbursed? And the quick answer to that is no. In the US, you buy an insurance plan, and whether or not you use that plan, you are charged the same premium as someone who does use the plan.
Okay.
The Associate Director of the EIJ Initiative is beginning at 10 a.m. in 100.
Hi, Eurisha. This is Sue again, and someone wanted to know if we have the meningococcal vaccine available at CSU, and yes, we do. We would just ask that you call and schedule an appointment with our schedulers, and that number is 970-491-7121, and just let them know that you need the meningococcal vaccine, and they will schedule you an appointment.
Thank you.
I also see, Urusha, a couple of questions about ambulance, whether that is a covered benefit. An ambulance is covered in the case of a true emergency. An ambulance ride to the hospital is covered. However, anytime you leave our facility, your $500 deductible does apply. So how this would work is when you get the bill for your ambulance ride, you would pay the first $500 out of pocket, and then you would be responsible for 20% of that bill till you reached your maximum out of pocket, which for an international student, the most that you can pay in a year, no matter how sick you get or how many times you would be hospitalized, would be $6,850.
There was another general question. Do I have to pay fees for medical services? Like I said, if you are in CSU Student Health Insurance Plan, and if you access the services at CSU Health Network, then you do not have to pay fees.
One other thing I'd like to mention about that, Arusha, which comes up often, is if you are coming into our facility and your doctor orders lab tests, and those lab tests are sent to an outside lab for processing because they're a specialty test, those go towards your deductible. And the lab department will tell you before you have those drawn if they are going to be sent out. If they are sent out, please remember that you are responsible for the first $500.
Yep. Like she said, we have a $500 deductible. So you'll be responsible for the first $500. And there was another general question. Medical services are available all time and every day. Like I said, we are open from 8 a.m. to 5 p.m. And we have after hours nurse helpline and also the 24/7 mental health crisis intervention line. There was another question about how to get dental care. We have a dental clinic, so you'll also make an appointment for those. And you can enroll in the SHIP dental plan if you want.
All international students are automatically enrolled in the dental plan.
And just another helpful information for all international students. So if you go to our website on the homepage, if you go all the way down, you can also translate our homepage in like 6 different languages. And the languages that are available are Arabic, Chinese, French, German, Russian, and Spanish. So if you want to translate our website in any of these languages, you will just need to go down to our homepage, and you can translate the web page in your language. And there was another general question: do we need to pay for the appointment with CSU Health Network? And the answer is no. You'll just, when you schedule an appointment, there are no fees involved when you make an appointment. Karen and Susan, are there any general questions that are not answered till now that you want to share? Or
Well, I've seen a couple people who have had trouble getting their immunization records. And what do you do if you are not able to do that? You have a couple of options. If it's for, depends on what it is for. If it's the measles, mumps, and rubella requirement that you don't have the documentation for, one in your, I guess I'll back that up, and you're sure that you've had both vaccines, then there is an exemption form that you could apply for an exemption, and it's on the CSU Health Network page under the new student checklist. There's a section about exemptions, and you would need to complete an online educational course through the Colorado Department of Health and Environment. And then when you complete that course, it's all online. You can do it any time of day. It generates a certificate. And then what we need you to do is print off the certificate before you submit it, and then upload that to the student health portal. And that will exempt you from proving getting 2 measles, mumps, and rubella. If you're not sure if you've had the measles, mumps, and rubella and want to do that series, we do have that available here at the Health Network. You would just need to call the scheduling line to make an appointment. And it is covered by the CSU insurance since it is a requirement of the university. Same goes with the measles or with the meningococcal. If you needed that vaccine and aren't able to get it before you come here, we have it here at the health center. You would just need to call and schedule the appointment. If you don't want to get the vaccine, you would just need to call the scheduling line again and ask them for an exemption. And there's a form that is put into the student health portal. And then you would need to complete that form. And then that would exempt you from the meningococcal vaccine.
thank you. There was another question about records where a student said that the record is in Arabic. Is that an issue?
We would prefer, well, we actually require that it is translated. We do our best, but sometimes we can't quite get it all.
Arusha, there's also a charge, a question about a charge on someone's account that says internet. When it says internet on your student bill and $817, that is the charge for the fall semester insurance premium. Every international pays the $817 premium for insurance. That is a reduced price over the domestic insurance because we realize that it's very expensive to be an international student. So you do get a reduced price.
There was another question that said, my confirmation to the vaccines hasn't come yet. So like I said, please give it up some time because it will take our staff about 2 weeks to process that information. So, and sometimes even when you've submitted the record, it might take us 1 to 2 weeks to process that information and show it on the student health portal. So check back after 2 weeks.
Oh, I see one that says they don't know if they've had the immunizations that are required. Are there tests? There are tests that can prove immunity to measles, mumps, and rubella, but I don't believe it is covered by insurance until you've met your deductible. And some of those tests are kind of expensive. So you would probably hit your deductible. Sometimes it's almost as cost effective just to repeat the series. If it's measles, mumps, and rubella, it's almost just as it's covered by the CSU health insurance. So it'd be better just to get the series again, and that wouldn't be a problem if you repeated that series if you had already had them.
Exactly, Sue. That's what we try to tell people is that as long as immunization says you can repeat a series, it's going to be much more cost effective than getting the titer, which is sent to an outside lab. Also, I see several questions on here once again about getting the stipend through their graduate school. Please contact your graduate advisor to find out if you are eligible for the stipend and when they will pay that. My understanding is they usually pay that about 2 weeks after the waiver portal closes and everybody is settled in classes.
There are questions about how Anthem digital card and all that. I can populate the information about how to access your digital card again in the chat. And it will have all the information about what login information is needed. And I also added the direct link to the Sydney Health app that you can download. And with this app, what you can do is you can view and use your digital ID card. You can check your cost or find a doctor near you. And you can also connect with a student support specialist. So if you scan the QR code of the Sydney app flyer, the link of which I've just added in the chat, you can just scan that QR code to download that app on your phone. That way you can have your digital ID card.
There's a question in here about Ameriben. So this year, starting this year, we are no longer brokering with Ameriben as an intermediary. Everything goes directly through Anthem. So every student on the student insurance plan must set up a new account through the Sydney app because your member ID number is changing. So if you go out into the community and you try to use last year's insurance card, it will not work for you. It's a total different policy, total different ID number and group number. So please make sure if you're having trouble with the Sydney app that you contact Anthem customer service and that you get that new account set up. You're going to need that new card.
There was another question. And the student says they've graduated from CSU last year. Do they need to upload all the immunization records again? Could you answer that, Susan? If they graduated already, do they need to upload all the records again?
Sorry, I was looking at another question. If they've already graduated from here, we should have, if it's from CSU, yes, we should already have their records. If they are compliant when they log into the portal or even RamWeb, I believe there's a big green check mark that shows that they have all the required, especially even in, I know in the CSU Health portal, there'll be a check mark saying that they've met all the requirements. So
There was another question that says their country does not have immunization records in other languages. Is there a way they can get an exception?
yes, they can. They can do, if they can't get them translated, then they can file for the exemption form, which they can find through the health portal on that new student checklist. If they scroll down a little bit, there'll be information about exemptions. And it's an online class that's open to 24/7, so they can do it whenever. And just submit the certificate that it generates to the student health portal, and then upload it to the student health portal. So we're good there.
Thank you.
Mm-hmm.
I see some confusion about enrolling in the insurance when you're an international student. If you are an international student, once you register for classes, about a week later, you will automatically be enrolled in the student health insurance. There's nothing that you need to do to sign up. It will automatically be added to your account. And another question about the insurance, you must register with Anthem to get your ID card. CSU Health Network cannot supply ID cards. Unfortunately, we don't have access to that database, so you're going to have to get it through Anthem.
And I also added the customer service phone number for Anthem and their website information in the chat for whoever is have questions about Anthem. You can call that number.
Yes, when you first log into Anthem, it will ask for your CSU student ID number. That's the main number they will identify you with until you register an account and you're assigned an ID number.
Eurisha, I need to go talk to a patient for a little bit, so I'm going to sign out. Is there anything else
Yeah,
that you can see? I think I answered if they don't. I don't know if the vaccine record is required for the Spur campus. Not familiar with that one, so I can't answer that question. And I don't think I saw anything else.
yeah, I think that's what it. Thank you so much
Okay,
for
thanks.
attending and answering all those questions.
No problem. Bye.
Arusha, I just want to repeat one more time. If you are an international student and you are having trouble registering your account to get your ID card, please call that Anthem number. Sometimes international accounts are a little bit trickier to get set up, and we're not exactly sure why, but Anthem will help you do anything that you need if you would just call that phone number that Arusha has put in the chat.
And I also see some like very specific questions about like individual medication or like things like that. And if you do have like, if you have like individual questions, you can always, like I said, call our number, and yeah, it will redirect you to different department depending on the department that you want to contact, and they will be able to answer your specific question about your case.
If you have questions about a specific medication, if you could just call the pharmacy direct with that medication, because a lot of times foreign medications are not sold in the US, and they will have a resource to where they can find out what the closest US medication equivalent is. So you would need to call them, and they can be reached at 970-491-1402.
Yeah, that was helpful. Thank you. All right, thank you, everyone. I think we pretty much answered most general questions. I see that our representatives were able to answer also questions that were populated in the Q&A section. And we also went over some questions in the chat. And I want to thank Karen and Susan for doing this and for answering the questions, and for being awesome panelists. And yes, thank you, everyone. Going forward, like I said, if you have any more questions that were not answered in this presentation, you can also send us your questions through Instagram. So follow us on our social media, CSU Health Network, and you can send us messages directly there, and we will be able to answer those questions from there. So,
And welcome to CSU. We're excited to meet you.
yes.
Thank you, everyone. So Rusha, I'm okay to end this, right?
Yes.
Okay. All right. Thank you, everyone. Have a great day.